Let's talk about something huge. What if a stroke didn't have to mean a life-altering disability? Well, that world just got a whole lot closer. The American Heart and Stroke Associations have just released a revolutionary new set of guidelines for stroke care. And believe me, it's a complete rewrite of the rules. So let's dive into how we're learning to win this critical race against time. You've probably heard the phrase, time is brain. It's everything in stroke care. I mean, think of your brain as this incredible, vibrant city. A stroke? It's like a sudden, massive power outage. And for every single second that passes, more of that city goes dark. These new guidelines, the first big update since 2018, they're like installing a brand new, super fast power grid designed to get the lights back on faster than ever before. And the stakes here are just incredibly high. We're talking about nearly 800,000 people in the US every single year. It's a leading cause of death and a leading cause of serious long-term disability. So when the stakes are that high, every second saved can literally be the difference between a full recovery and a life that's been changed forever. So how do we start clawing back those precious seconds? Well, the answer now starts before a patient even lays eyes on a hospital. You know, the first real game changer in these guidelines isn't a new medication or some fancy surgical technique. No, it's a total rethinking of where stroke care even begins. Instead of this mad dash to get the patient to the hospital is now coming directly to the patient. Okay, picture this. An ambulance that's not just for transport. It's for immediate diagnosis and treatment. That's a mobile stroke unit. It's basically a high-tech emergency room on wheels, packed with a CT scanner and a specialized stroke team. It's a concept that is changing the entire landscape. So this is where the magic really happens. A mobile stroke unit doesn't just save a little time, it completely rewrites the timeline. By doing a CT scan right there on the spot, the team can figure out immediately if the stroke is caused by a clot, what we call an ischemic stroke, and that is so important because it means they can start giving life-saving, clot-busting medicine before the wheels even stop turning at the hospital. This isn't just a small improvement, it's a full-blown revolution in care. All right, so once the team confirms there's a clot, the next mission is to destroy it. And this is another area where the new guidelines introduce a much faster, way more efficient weapon into our arsenal. For years, the go-to treatment was a drug called alteplase. And it works, but it's delivered through a 60-minute IV drip. That's an entire hour of critical brain-saving time. Now, what if you could replace that whole hour-long process with a single, fast injection? Well, that's 10-ectoplase. It's one shot, and the fight against the clot begins instantly. And really, the beauty of tenecteplase is its simplicity. It's just so much easier for medical staff to give, especially in a chaotic ER or, a moving ambulance. Plus, it makes it way easier to transfer a patient to a more specialized center if they need it. It's one of those small changes that has a massive cascading time-saving effect.
So we've sped up the clock, right? But what if we could also add more time to it? Well, that's exactly what these new guidelines do. And this is one of the biggest shifts. The window of hope for so many stroke patients is now wider than it has ever been.
Think about this. What if you wake up with stroke symptoms? You have no idea when it started. In the past, you might have been considered too late for treatment. But now, with advanced imaging that can actually see which parts of the brain are still salvageable, that window for clot-busting drugs can be stretched up to 9 hours. And for some people, the window for a life-saving clot removal procedure is now a full 24 hours. That's a whole day of hope that just didn't exist before. So what is this incredible clot removal thing I'm talking about? It's called an endovascular thrombectomy, or EVT. You can think of it like a tiny, high-tech plumbing snake for your brain. Doctors guide this little catheter through your blood vessels, they navigate all the way up to the clot, and then they physically pull it out. It's just an amazing piece of modern medicine. And here's what's truly groundbreaking. Who is now eligible for this procedure? Doctors use a scoring system called aspects to look at early brain damage on a CT scan. A lower score means more damage. And before, a low score often meant you were out of luck for thrombectomy. But now, thanks to powerful new research, even patients who've had more significant strokes with scores as low as 3 out of 10 can still have a chance at recovery with this procedure. And the good news doesn't stop there. The procedure is now also strongly recommended for certain types of strokes that happen in the back of the brain. And this is huge for some patients who already had a mild disability before their stroke. This is a massive leap forward in making sure these incredible treatments are available to more people. With all of these incredible advances for adults, one group has often been sort of left in a gray area: our kids. But now, for the very first time, these guidelines give us a detailed, evidence-based plan for treating stroke in our youngest, most vulnerable patients. You might be thinking, wait, stroke in children? Is that common? And the answer is yes. It absolutely happens, and it's a reality we have to be ready for. And what's really critical is that the warning signs can be different, so it's vital for parents and caregivers to know exactly what to look for. Now, kids can show those classic FAS symptoms, which we'll cover in a sec, but these new guidelines highlight other crucial signs, so be on the lookout for a sudden, really bad headache, especially if it comes with vomiting, or brand new seizures, any sudden confusion, problems with vision, or trouble with balance. Recognizing these signs is the absolute first life-saving step. And this is the part that gives me chills. The guidelines now officially say that those same advanced treatments we use in adults, the clot-busting drugs, the mechanical thrombectomy, can now be considered for eligible children. This is just a massive victory for pediatric medicine and a huge beacon of hope for families everywhere. Okay, mobile stroke units, single-shot drugs, 24-hour treatment windows, and now, finally, guidance for kids. All of these incredible advances have one thing in common. They all depend on you. You are the single most important player in this race against time. Because without you, the race can't even start. So let's say you're with someone you love, and you notice their face is drooping on one side. Or maybe their arm suddenly goes weak. Their speech gets all slurred and hard to understand. What do? You act FAST. F is for face drooping. A is for arm weakness. S is for speech difficulty. And T, the most important letter of all, is time to call 911. That one phone call is the starting gun. It's what triggers this entire life-saving chain of events. Look, the 2026 stroke guidelines have given us more time, better tools, and a much wider window of hope. They've pushed the finish line further down the track, giving more people a much better shot at a good recovery. But the race against time, it still starts with us. By knowing the signs and acting fast, we can all be heroes in the fight against stroke. So let's win this race, together.